Assalamualaikum warahmatullahi wabarakatuh. We are from group 6 and we will present several journals with topic speech delay in early childhood. Before we present our material, let us introduce ourselves. My name is Belja Sari, NIM 16014200055.
Saya Siti Aisyah Inafazri dengan NIM 16014200051.
Nama saya Rika Rahwati, NIM 16014200052. Speech delay. Speech delay is general term referring to the process of speech and language delay that are not in accordance with the child developmental age. The children's speech development is influenced by physical and environmental factors. The cause of physical factor is related to the problem, but the role of environmental factor is more complex because it involves the educational role of family as starting point of the children's ability to speak. Speech and language in children. Case story. A 2-year-old boy present to primary care with fewer words than his birth. He has a hearing the threshold greater than 40 decibel with the flat tympanogram slowing conductive disturbance consonants with autism media with even or OME. For 3 months, the child was actively observant and referred to in-ear, nose, or throat consultant with advance of present conducive hearing loss. His parents were selected for grooming. At follow-up 2 years, 6 months, his vocabulary had grown to greater than 1,000 and the audiogram showed a traverse greater than 20 decibels within the normal range. The treatment, the car treatment training for OME is grommet insertion. Early language development of children with expression language disorder. Parents narrative. Case story. Zaid is 5-year-old boy diagnosed with expressive language disorder at the age 9 years who is projected to develop dyslexia at a later age. Factor 1. Busy parents. The busyness of Zaid's parents made Zaid less active and lacked language skill, making Zaid lag behind in the development of his peers compared to his friend. And 2. Parents using two languages when they talk. The habits of Zaid's parents who speak two languages make it difficult for Zaid to use the language and speak English more often. And in this case, old man Zaid has done a lot of psychological tests and consultation in many places. But back to Zaid's parents, and Zaid can learn to talk again when Zaid's parents focus on the taking care of Zaid and spend a lot of time playing and learning with Zaid.
Speech delay. Some possible factors. A research on 3 to 6-old children. This research was conducted with a qualitative, descriptive approach, and the research method was a case study, which included 3 children under 7 years old. This part describes some possible factors that may cause speech delay on children. First, maturation delay. Secondly, bilingualism. Bilingualism may be the main factor of speech delay for F. His mother said that since he was a baby, he watched English YouTube channels. Thirdly, KH and F probably having social deprivation harm speech development. It is said so because KH herself having a busy parent with grandmother as a caregiver who was also insufficiently having time to stimulate her to acquire the first language. Lastly, receptive aphasia. The 3 children may possibly have receptive aphasia. This condition is caused by production problems and speech delay. Their parents sometimes refer to their children as not listening rather than not hearing. This child's speech was not only late but also inconsistent in form and articulation. Communication strategy for children with speech delay. Some children aged 5 years at junior kindergarten have speech delay. The child's ability is only limited to saying 1 or 2 words. When the child was asked to communicate, the child just repeat the question. The results show that the communication strategies used by parents and teachers were almost the same, such as using slow speech, clear articulation, routinely invited to communicate, correcting pronunciation errors, and using hand gesture as symbolization. The implementation of this communication strategy can improve children's speaking ability.
Risk factor for delayed speech in children aged 1 to 2 years. The risk factors are: first, children with delayed gross motor development were more likely to experience delayed speech development. Motor development may change language development in children by providing more opportunities to experience the world. In other words, motor development such as a change in posture and locomotion supported by object manipulation is highly stimulating to an infant's speech development later in life. Second, the presence of polysaturated fatty acid such as omega-3 and omega-6 in breast milk has been suggested as the mechanism underlying between breastfeeding duration and speech delay. Study by Festus-Gard, which stated that children with increased duration of exclusive breastfeeding would display early speech and language skills that are indicated by polysyllable babble at the age of 8 months old. Third, out of the 63 children with speech delay, 42.9% were exposed to media for more than 2 hours daily. Evidence suggests that young children are not proficient in learning words from media. Thus, exposing them to gadgets and televisions worsens their language acquisitions by decreasing the quantity and quality time of the parent-child relationship and children's play activities. Speech delay therapy for children using the AAC method. AAC or Argumentative Alternative Communication, which is designed to improve functional communication between individuals with ASD or other autism spectrum disorders and other developmental disabilities who have significant communication disorders. This AAC is visual-based for strengthening expressive and receptive communication and other behavioral principles. Users are trained to communicate via pictures and PECs or picture exchange communication system, using low-cost materials that are relatively easy to manufacture so that they can be applied in schools with minimal skills. Integrated sensory therapy includes tactile, vestibular, proprioceptive, visual, auditory, olfactory, and taste aspects. Speech therapy with the PECS method is very effective in improving her speaking skills. A kid with very minimal skills at the start of therapy, at the end of therapy, using the AAC method has tremendous progress. So the conclusions is, factors that cause speech delay in children are: first, otitis media with evasions or OMI; second, habit watching video in different language; third, delayed gross motor development; fourth, duration of breastfeeding of less than 6 months; fifth, media exposures for more than 2 hours daily; 6. Lack of interactions between children with their environment and with their peers. 7. Lack of attention of parents to their children. And the last is, many parents did not acting as a good speakers. Treatment for children with speech delay are: first, as a parents or teachers, speaking slowly and clearly with children. Second, routinely talking to the children. Third, correcting mistakes and pronunciation. Fourth, using hand movements as a symbol of what is being said. Fifth, immediately take the child to a therapist. Sixth, therapy sensory integration.